Good morning, everyone, and thank you for joining today's webinar. My name is Hannah Booth and I'm the Communications Manager here at Moorepay. This is one of the regular updates that we do on coronavirus. Now, for those of you that haven't joined any of the previous updates, I do have a couple of housekeeping points to run through before we begin the main body of the presentation. Everyone's audio is set to mute, but that doesn't mean that you can't ask questions throughout the webinar. We'll be running a Q&A session at the end of the presentation, and in a couple of slides time I'll go through how you can ask questions throughout the webinar for that. In terms of presenters for today, we've got Audrey Robertson, who heads up our HR consultancy team, and we've also got Phil Barker, who heads up our health and safety team. They will take you through today's presentation and also answer any questions that you may have at the end. If there are questions that we don't get a chance to answer within the main body of the session, we will also come back to you after the webinar. The webinar is scheduled to last for 30 minutes. Sometimes we do end up running over. So if you have to drop off at any point, don't worry, because the webinar is recorded and we'll send out a recording to you as soon as it becomes available. So in terms of the agenda for this morning, we'll run through the current stats and advice, some health and safety updates and information on local lockdowns. We'll then move on to an update on the job retention scheme, and we'll also cover taking employees' temperatures. As I mentioned, there will be a Q&A session at the end of the presentation. Your GoToWebinar panel should have a question box where you can post questions. You can post those throughout the presentation, and then we'll go through all of them at the end. So I will now hand over to Audrey, who will take you through the current stats and advice. Thank you, Audrey.
Morning, everybody. Thank you for joining us, and thanks, Hannah. Just as normal, just going to quickly go through the latest statistics that we have. The virus circulation is still present, but continuing to fall. You can see there on the right the rolling 7-day average and the total number of deaths that have occurred. Yesterday, there were a further 16 deaths and 352 infections reported, and those are the lowest numbers really since early March. If we can move on to the next slide, please, Hannah. So the government has issued alert levels for the virus. Previously, as you may remember, it was at level 4. We're remaining at level 3, even though things are starting to ease up and the rates of the virus are starting to fall. So level 3, the epidemic is still in general circulation. It's obviously important to bear that in mind as we move forward with some of the things that are happening. So I think on the next slide, we can see what the latest updates are there. So as I'm sure all of you know, pubs, restaurants, hotels and hairdressers were able to open as of Saturday the 4th of July in England. They're also opening from yesterday in Scotland for outside consumption. As part of the government's track and trace system, people attending premises are expected to give their names and phone numbers in case they later become ill. There are still some restrictions on non-essential international travel, but there is some easing of quarantine restrictions on entering England from some specific places, and that starts later this week. Social distancing has been reduced to 1 metre plus, and the meaning of this is that 1 metre is generally considered safe where other precautions are able to take place, such as face coverings and avoiding face-to-face contact, and Phil will give us some more information about that. And yesterday in Wales, the 5-mile travel limit was lifted and extended bubble households. 2 households can now be as one in Wales. And I think we're going over to Phil now. Is that right, Phil?
Yes, thank you, Audrey. If you should move on to the next slide for us, please, Hannah, thanks. And again, anybody who was on last week's, this is a repeat slide, and I make no apologies for that. It's just a reminder of how the virus spreads. There are two main routes that the virus will spread from: people coughing, or just in general conversation where moisture is expelled from your respiratory tract into the atmosphere. That can be breathed in by somebody, and this is where the 1 metre and 2 metre social distancing comes in. Obviously, the closer you are to somebody, the more likely you are to breathe in infected particles if they're expelling contaminated moisture from the upper respiratory tract. Just seen some evidence recently that there are now 2 versions of the COVID-19 virus, just to make things more complicated. One of them is thought to survive better in the upper tract, and is more likely therefore to be coughed out, and this is the one that is thought to be creating most of the infection rates since March. The previous version sort of tends to live further down in the lungs and doesn't come up as easily when people are coughed. So this new version is thought to be the main cause of the spread at the moment. Obviously, I'm not a virologist, and Sheffield University are doing the research, are very new into that research program. So no doubt that'll probably change, but that's where the Sheffield University are publishing the results at the moment. The other way that obviously it gets into people or into your respiratory system from somebody else's respiratory system is where that moisture, that contaminated bodily fluid, for want of a better description, lands on a surface. So then it lands on a desk, it lands on a door handle, it lands on anything else really that's a hard surface. Bearing in mind it can stay on a hard surface for anything up to 72 hours, does start to decay 24, 48 hours, but the virus can still be there 72 hours later. You touch that surface, you don't wash your hands, you then scratch your face, rub your eyes or whatever, and then the virus then enters your body through that way. So 2 real main routes is obviously directly inhaling somebody's expelled breath, or touching a surface and then touching your face where that surface has been contaminated and moving the contamination on. Again, also just a reminder there that under Regulation 3 of the Management of Health and Safety Regulations, we have to complete a risk assessment to protect our staff. That has been, coronavirus has been extended into that. We wouldn't normally do a risk assessment for colds and flus, which are some of the other coronaviruses that are out there in general circulation. But given the nature of the current variant and the current the COVID-19 or SARS version 2, whatever you want to call it, then that due to that virulent nature, we are expected to do a health and safety type risk assessment for the virus in the workplace. I want to move on to the next slide for us, Hannah, please. So what are we looking at now? We're starting to see in the news, you'll see local lockdowns. Now, the general basic approach to this in oversimplified terms is that wherever they get an outbreak, the public health officials from Public Health England and local authorities, or Scotland and Wales equivalents, will try and isolate the location. So we're seeing individual workplaces and pubs closed following confirmed cases. Overnight, there were 3 pubs reported on the BBC News as being closed due to people turning up there on Saturday who've now tested positive. And they're now busy tracking all of tracing all of the people who were in the pub on that day to try and work out who may or may not be infected. So that underlines the importance of making sure that pubs collect the names of people that are in the pubs, and same with restaurants. If they can't lock it down in a factory, then or a workplace or a care home, or if they can't specify and tie it down into one individual area, then we're looking more like what's happened in Leicester, where, as you can see, the whole city is basically going back into lockdown that the rest of the country was experiencing 4 or 5 weeks ago. So no pubs opening, non-essential retailers closed, more travel restrictions in place. So basically, Leicester has gone back to, like I say, where we were 3, 4, 5 weeks ago. Just a press clip in there as well. Not 100% sure of the validity of some of the comments, but I've seen the same comments in various other medias, that the thought process behind why it's in Leicester as it widened is that it wasn't controlled at the workplace. So some of the factories weren't enforcing social distancing. They were encouraging people to go to work when they had symptoms, pressure on supply chains, etc., etc. Now, again, these are just press reports, and until we see some official HSE Public Health England reports, then these have got to be taken with a pinch of salt, but they are from multiple sources, and Matt Hancock was on the news over the weekend saying something very similar. So there is some credibility there, but not necessarily saying that it's 100% accurate, and we'll wait until we get the full data. But it does start alarm bells ringing as if you're an employer, that you need to make sure that things are in place properly. But could we move on to the next slide, please? Yep. So how do we avoid local closures? So where possible, employees who can work from home should work from home. And again, I've said this on numerous previous webinars, it's not where desirable, it's where possible. We're getting lots of queries where people say, I want to go back into the office because I don't like working from home, or I don't think my staff have been as productive at home as they are in the office. In my opinion, they're not reasons why it's not possible to work from home. They're desirable. It's more desirable in those situations for people to work in the office, but it's not essential. So in those situations, unfortunately, we need to keep people working from home to prevent that spread from the workplace to the home, or from the home to the workplace. Actively encourage staff with symptoms to stay at home. I mean, we all know in the past, somebody has a little bit of a sniffle and they'll come into work. Somebody has a cough and they'll come into work. Obviously, at the moment, that is one thing we want to avoid. Anybody who's got any of the symptoms that are on the right of that slide, stay at home. Stay at home until we know that you've gone through the 14 days and the symptoms have gone, or you had a test and you've tested negative for the virus. So again, let's get people at home if they're suffering from the symptoms. If somebody comes into the office and have the symptoms, get them home. Ideally, your procedures should have a room within the workplace where you can put somebody to sit, whether it's a meeting room, an office, but somewhere that's dedicated as a semi-isolation area. So anybody who is symptomatic can sit there and wait till things are arranged to get them home. After that, we then obviously need to make sure that area is cleaned. Anywhere that they've touched is cleaned. And we need to really, really encourage and cooperate with the NHS test and trace. So anybody who's got the symptoms, really be encouraging them to get the test done. Now, it's not a nice test. I've spoken to people who've had it done. It's rather uncomfortable, so I can understand why people wouldn't want to go for the test, but let's encourage them, because it's the only real way that we're going to understand whether there is a potential outbreak in your workplace that could spread into the community, etc., etc. Just want to move on to the next slide for us, please. So again, this is moving on to, I'm not sure if it's mine that's frozen or yours, Hannah, but we've not moved on, but I'll talk through the next slide. So again, as part of avoiding the local lockdown, we need to have the risk assessment in place. We have the poster on the right, which is available from the government as a website as a download, and that is a way that the employer can sign off to say they've done the steps. So carried out a risk assessment, developed cleaning regimes, help people work from home where possible, keep 2 meter social distancing where possible, and where people cannot be 2 meters apart, manage that transmission risk, which is where the 1 meter plus comes into the discussion. Now, within the government guidelines as well, it's saying that any employer who employs more than 50 people, the government are expecting the risk assessments and this statement to be published on their websites. So there's a real pressure for larger a larger end of the SME market, or probably the medium end of the SME space, really, to start to publish these risk assessments on their websites. And that is obviously to encourage customers and to encourage employees that you're taking things seriously, and that they can come into work or come into your business and be safe and not at risk from catching the virus. Do you want to move on to the next one for us, please? Thank you.
And
over to you, Audrey, on this one.
Over to me, yes. This week we've sort of mixed up a few of the health and safety and HR ones, so we can kind of concentrate on a couple of topics. But I know it's always useful for the people who come to this webinar to kind of get a bit of an update on the furlough system. So as you probably know, from the 1st of July, a flexible furlough system started where you can furlough people part-time. Effectively, it is a separate scheme to what was previously in place. So you can still submit claims under the original scheme for periods of furlough between March and the end of June, and you've got until the 30th of July to get those claims in. So do make sure you look back and make sure you've claimed for everything you need to between March and the end of June. Under the 2020 finance bill that's going through Parliament, there are some provisions now for companies who voluntarily repay furlough monies where they found they've not needed it. And I think there was some publicity yesterday that Barratt's, the builders, that have done that. And there will also be provision for enforced repayment where employers have either claimed the wrong amount or where the claimed amounts haven't been properly passed on to employees. Where the investigation shows that may have been fraudulent, there's an option for penalties as well. There's a 30-day amnesty period to report your own errors to HMRC, and all these measures are expected to pass Parliament this month and come into force. The scheme has cost £25 billion to date, and whereas the consensus is that this was a useful way to protect jobs, as the recession bites, follow-ups and investigations are very likely to ramp up. There was some discussion last week as well about whether furlough monies can be used for statutory notice pay in a redundancy situation. There was a slight changing by the government in the wording that emphasised furlough money is intended to be, quote, integral to protecting jobs. So there's been some questions about how that works with redundancy situations. So if you put somebody on notice, can you use furlough money for that? So although it's not legally binding and could be challenged, HMRC have confirmed that you can make statutory notice payments using furlough money. If you are in a redundancy situation, do be aware of this, particularly if your contracts oblige you to pay more than statutory notice amounts. So if you have additional contractual notice sums that are due to people who are leaving you, you may want to consider paying that from your own funds and not using furlough money. Statutory notice is, in very general terms, 1 week for each year of service, up to a maximum of 12 weeks. Just to kind of circle back to what Phil was saying, a local lockdown means you can actually refurlough employees who have been refurloughed. You've got till the end of October, although, as we've discussed before, there are some cost implications as we move through the running down of the scheme. But if you do find yourself in a local lockdown situation, even if you've got everybody back full time, if they've been furloughed before, you will be able to access those payments again. There's some new announcements expected from the Chancellor this week, including potentially payments to take on younger workers. So do keep an eye out for that. And there's my typo there, it's £1,000 they're expecting, not 100, so a bit more of an incentive there. And I think we're going to go back to Phil now, and then I'll come back to you a little bit later to talk about some of the checks on coming into the workplace. Thank you.
Thanks, Audrey. Right, so one of the things that we're starting to get questions around is temperature monitoring in the workplace. So on the next slide, we'll look at temperature checking in more detail, but I just thought it's useful again here to put up the hierarchy of controls. So this is from SAGE, so the advising body that's advising the government. I can't remember how many scientists are on there, but it basically follows the standard health and safety hierarchy of controls for any hazardous substance. So first of all, we eliminate the risk, excuse me, then we substitute it, put in engineering controls, admin controls, and last of all, PPE. So again, what we're saying here is that PPE, so using face masks, should be the last thing we consider, not the first thing. So going back to what I was saying earlier, elimination, so where people can work from home, they work from home. Substitution, can we look at technology to replace face-to-face requirements, so use of Microsoft Teams, even if we're in an office situation where you've got people in the same building, maybe not an office situation, that's probably the bad wrong analogy there, but if we're in a workplace where you have to be at work, so an engineering works and you need to have a team meeting, perhaps do that over Teams or virtually rather than get people into a small room together so that we're not spreading people out or minimizing face-to-face contact. If it's manual handling and it'd normally be 2 people that need to lift an item, can we automate that? Can we use a forklift truck? Can we use any other method that doesn't mean 2 people standing next to each other or across from each other lifting a piece of plywood? Engineering controls, one of the best ways that we're looking at of controlling this virus is ventilation, which is why outdoor activities are getting precedence over indoor activities at the moment. So if you are indoors, doors open as much as possible, ventilation systems on. Obviously, that's nice at the moment while we're in July, August, probably into September. But once we start getting into October, November, December, perhaps not such a good thing. We'll be wanting the heating back on. But while we can, let's make the most of the fact that we can ventilate the workplaces. Hand washing. So again, going back to how the virus is spread, make sure that people are washing their hands regularly. We're cleaning down contact surfaces, etc., etc. And these controls work on both sides of the equation. So they work in preventing the infection coming into the office or the workplace, but also mitigating the spread if it has appeared within the workplace. So it's the same kind of thought process for both, that we need to be thinking about masks as a last resort and engineering and admin controls further up in our thought process. So if you just want to move on to the next one for us, Hannah, and we'll look at some of the controls in more detail. So temperature checking. Again, we've just talked through the hierarchy, so I'm not going to labour the point on that one. But temperature checking is a way of health surveillance, and traditionally in hierarchy of controls, health surveillance comes down lower down the pecking order. It tends to be used in control of chemicals to work out whether your controls are working. So if you're working with lead, if you're working with asbestos, if you're working with isocyanates, you'll have regular monitoring, whether it be chest monitoring, blood monitoring, etc., to work out whether you have got lead or asbestos or whatever into your system. And it's a way of checking that your control measures are working. Now, it's slightly different here with temperature checking because there is an element of we'll identify symptomatic people in the workplace. The problem there is it will only identify people who are showing a high temperature. There is increasing scientific evidence that people who have not got the symptoms, so asymptomatic, or people who are pre-symptomatic, i.e. they've got the virus but the symptoms aren't showing yet, can pass the virus on. So whilst temperature checking will pick up a number of people who might have the virus, it will also pick up people who've got a common cold or other illnesses, maybe food poisoning. Some of the food poisoning illnesses create high temperatures. So just because someone's got a temperature above 37.8 does not mean that they've necessarily got coronavirus or COVID-19. And people who have COVID-19 may not necessarily have a high temperature. So yes, it's a way of identifying a cohort or a number of people, but you might be missing another significant number. So the call out from a health and safety perspective is don't rely on temperature checking in place of everything else that we've talked about on the previous slide. It is a way of identifying who may or may not have, but that is about as far as you can go with it. There is a strong potential failure rate in relying on this as your single control. So it's part of an overall package. And obviously there are GDPR issues, and I think Audrey's going to talk those through more on the next slide. So if you want to move on to the next slide for us, Hannah, that would be great.
Thanks, Phil. Yes, I'm going to kind of join Phil in being a bit lukewarm about temperature testing from an HR perspective as well. Obviously, you can tell someone not to come into a concert hall to watch a show or get on a plane unless they agree to a temperature test, because that becomes a condition of the contract. They comply or they don't get on the flight or whatever. So you already have a contract with your employees in place, and it's also complicated from an operational point of view if someone says no, they don't want their temperature taking. So you need to have a justification that's either covered by a clause in your handbook or a special written agreement where people openly sign and agree to have their temperature tested when they come into work. It may well be covered, particularly if you have a Moorepay handbook, in a clause about your organisation's duty of care to keep everyone safe under health and safety legislation. So read your handbooks carefully if you're thinking about going this route. If not, do definitely make a new agreement. You can put a policy in place, but this requires really careful thought because there's quite a lot of onus on you, the things you need to do to make that run properly. And you'll need to make sure your equipment's properly calibrated, it's effective, are you getting proper readings, is the person who's actually taking temperatures been trained to carry this out. Goes without saying, it should really be some non-invasive laser type equipment, but again, that has its own problems. In terms of data protection, you need to ensure that all the data you process is necessary and relevant for the stated process. That's the quote, and doesn't result in any detriment to your employees. So this doesn't just apply to temperatures, but to other requirements and data you might gather. It also applies, for example, if you wanted to keep a list of employees who've had COVID tests or have had COVID. It's not clear why you might want to store people's temperatures or that information. Medical information, including someone's temperature or the fact that they've had a test, is known as sensitive personal data, and there are special, more stringent regulations. The general principles are to be able to justify what data you collect and process, keep it to a minimum, and only use it for the purpose beyond, don't use it for any purpose beyond what's stated. So, and a big question is, what are you going to do if you discover someone's got a raised temperature? So as Phil said, COVID's not the only thing that raises temperatures. Raised temperature isn't a symptom in every case of COVID. It's not even necessarily a case of disease at all. So you may want to keep someone near the entrance, retest them half an hour later to see if their temperatures come down. You might require them to go and get a COVID test. There are no rules about this, so you just need to make a plan about what you intend to do, and you may decide that other measures will suffice. Your absence policy is almost certainly aimed at minimizing everyone's absence, and now you really need to create a culture where reporting, track and trace, self-isolation or COVID is encouraged, repeatedly encouraged. Keep reminding everyone not to come in. It's perfectly all right to treat COVID as an exception to the way you normally deal with sickness. You're not going to be creating a precedent. You could potentially even set it out in writing as a temporary change to how you deal with sickness. So not using your absence triggers and so on over COVID-related absences. If you do tell people to go home sick, you are effectively medically suspending them, and that means you need to pay them in full. So do be careful not to do that unnecessarily. You should be able to avoid it just by encouraging people to monitor their own health and report symptoms. If you do end up sending someone home and then they get a COVID test that proves positive, you could then sort of switch to your normal sickness provisions, and that's okay. In general, with all the measures you take with people coming into the workplace and operating safely there, really the absolute best way is to take your employees along with you. Communicate with them clearly, follow the guidelines, be proportionate in your response, and try to encourage people rather than taking more draconian measures like disciplinaries. So are we going back to Phil now, or I think possibly back to Hannah? Where are we? What's on the next slide?
Back to myself now, Audrey. So thank you to yourself and Phil That was really useful. Now, in terms of how Moorepay can support you going forward, we do offer a number of consultancy packages to help businesses, whether that's emerging from the lockdown, whether that's implementing long-term home working, or whether that's assessing your legal responsibilities under health and safety legislation. If you are interested in finding out more, then please post a comment in the question box and we will be in contact with you. So we'll now, as we're reaching towards the end of the session, we will quickly go through a few questions before closing off. So continue to drop any questions that you have into the questions box. The first question that we've received is, we have returned to the office, but an employee has gone home sick with possible symptoms. Do we need to close the entire office?
I'll pick up that one on Audrey. This is a question that we've had a few times in the last few days, actually, on our 24-hour advice line. So I'm pretty rehearsed at the answer. If you're talking specifically office work, I would just remind everybody of what we said earlier, that where you can work from home, you should work from home. And would be questioning why people are returning back into an office environment and whether that is the right thing to be doing. But also, if one person is sick and they have the symptoms, there's not normally a need to close the office down. Obviously, the public health officials and the local authority may do a risk assessment and take a view that there is a need, but there is not normally a need to actually close the offices down yourself. What you would do is go through a cleaning regime. Again, like I say, make sure that you've got in advance cleaning chemicals to be able to wipe down any hand contact surfaces, any places where that person may have worked. Probably going to want masks, because to make the person that's doing the cleaning feel safe. Whether they need them or not is debatable, but sometimes at the moment we're in a situation where people need to feel safe, not just be safe. So we might just have to provide equipment for what are not technically the correct reasons, but it does make your employees feel a little bit safer. So really, yeah, just isolate that person so that you can get them out of the building, and then clean down any areas that they've been in, and then wait for public health officials to say whether you need to actually go any further than that.
Brilliant, thank you, Phil. The next question is around aircon, and the question is, what is the level of risk on recirculating aircon in an office? We had turned it off, but if it gets too warm, can we switch it back on? Is the risk low enough to offset the need?
What the guidance is on recirculation is switch your recirculation off. So if your aircon is capable of working without the recirculation of air, then use it in that mode. I would not. The research, again, the science is varied, and depending on which report you read on the recirculation. There is evidence that in Wuhan, back in before Christmas, they were using recirculation air conditionings in restaurants, and that may have increased the risk. But then you look at other people and say that recirculating is not that big an issue. But I would take the safe option. If you can use air conditioning that's not got where you can switch the recirculation off, then you do so. Now, if you think of if your car heating system, you've got two options, haven't you, where you can bring air in from the outside that is either warmed or cooled by your car system, or you can recirculate the air within the car. It's the same kind of process with an air conditioner in an office. If you can just have it set so that it's just bringing fresh air in from the outside, either heating it or cooling it, and then moving that around the building, that is the safer option. And I would avoid the use of just recirculating until there's more proof that it's not a risk.
Thank you, Phil. The next question is around the fact that shielding is ending from the 1st of August, and the question is really saying that, can employees still work from home if they don't feel confident to return back to their workplace? Sort of, where would the employees stand in relation to that?
Well, I'll take that one first, Audrey, shall I? And then
sorry,
do the health
Phil,
and safety bit, and then you come in.
Yeah, I was just going to say, as Phil will no doubtedly remind us, if you can work from home, you should still be doing that, and that's really not related to shielding. So if you have got an employee who's not comfortable to come back in and their work is capable of being carried out, that's absolutely the fundamental of that answer.
You read my mind.
That's good.
And I guess if it was an environment where home working wasn't possible, then where would the employees stand from that perspective?
I think that anybody who's got an illness is vulnerable. And if you just go back to the normal health and safety principles of vulnerable people needing individual risk assessments. So you would just look at that individual and maybe tweak the way they work or how they work, just to make them feel safe. Again, let's take this away from a strictly health and safety point of view. You want that employee back in your workplace doing their job at something like 100% efficiency. If they're not feeling safe in the workplace, they're not going to do that. And as Audrey is probably going to point out, if they don't feel safe, they have the right to refuse to come into work. So you need to really have a conversation with that individual and come up with a way of working that gets you productivity and they feel safe. Now, it may be that they work in an isolated area of the factory or the production area or the restaurant or wherever, or you give them extra PPE to what everybody else has got because of that vulnerable status. A lot's going to depend on what their illness is and why they were shielding.
Yes,
Okay.
I mean, I would really echo that. You need to have from an HR perspective as well, exploratory talk with them to see what their specific worries are. It rather depends on their state of health and their mental health. But as I said earlier, trying to bring people with you rather than sort of confronting them. I mean, ultimately, if somebody refuses to come to work and they no longer have, as it were, the protection of being told to shield, ultimately, you could insist that they came in, but that probably isn't going to end well from anyone's point of view. So yeah, talk to them and find out a bit more.
That's great, thank you. We will close the questions off there. Thank you to everybody that did ask a question. This is our last regular webinar within this series. However, if there are any major changes, then we will be hosting additional webinars, and we'll also continue to update our knowledge centre. Within here, there's lots of guidance, there's blogs on COVID-19 and also on other relevant topics that may be of interest to you. So that just leaves me to say thank you for joining us today, and also thank you to Audrey and Phil for hosting the webinar and for answering your questions. I hope you have a lovely day, and we will follow up with the recording as soon as it becomes available. Thank you very much.
Thanks, everybody.
Cheers, bye.